Hey guys, welcome back to my channel. It's Tash and Asiri, and today I'm making a video of what a typical day looks like in public health nursing. As you guys know, I'm in my community rotation, which means that I get to shadow someone on Tuesday and Wednesdays throughout their shift to see what it looks like. So here I just had breakfast ready. That was my outfit of the day. I got a ride to the clinic, which was very nice of my parents. Thank you so much. When I got to the clinic, the nurses there hadn't gotten their assignments yet. There was a lot of waiting around for that, and during this time they spent a lot of it researching and updating their current knowledge on current events or current illnesses and disease in the community, and researching things that they can basically provide teaching about later on. We spent a lot of the rest of the shift just doing modules, and this was the break room. After shift, Patrick and I headed to his family's place where we did some babysitting for their newborn baby. He was so cute. I got to give him a little baby bath. I love him so much. And for dinner, Patrick made one of those meal prep kits that are around in Vancouver, which was actually really good. I think it went really well. Good job, Patrick. On the way home, it was dark and rainy, but we got an Evo, so it wasn't too bad. We were talking a lot in post-conference today about how public health nurses do so much behind the scenes as a preventative measure, but now that there's a pandemic going on, they're all getting pushed to do vaccines and do things that they wouldn't normally have been doing. They're super behind on all the programs that they were running previously, and it really makes me appreciate how much public health nurses actually do, because when I think of nursing, I just think of the nurses that work in hospitals and the ones that work in hospital-like clinics. So it was pretty interesting and eye-opening to be able to shadow them for the past couple of weeks. The next day I woke up and then I made my bed. Afterwards, I opened the blind and appreciated how nice it looked outside because yesterday was so rainy. It's Wednesday. This is what I'm having for breakfast: a bowl of Greek vanilla yogurt and some strawberries, and then some rice, crackers, and avocado. It's a little bit of salt and pepper. It's so good. Hi, so it's Wednesday and I'm starting late because my instructor said that the clinics today would run later on in the evening. So we're gonna be at the clinic from 10 to 6 instead of 8 to 4, which is fun. I am just eating breakfast, which is really good. Ignore the mess, sorry. I had a really good sleep in last night. Tuesday, Wednesdays is my rest day, so it's nice to take it easy. My dad's gonna drive me to the clinic again today, and I think I'll stop by the coffee lounge to grab a coffee before going. And I'm really excited to start the day. I think it's gonna be a great day. The sun is shining. Yesterday was raining when I left the clinic and I didn't have a jacket or an umbrella, and I was really sad. It was a sad day. This is me appreciating the view from the elevator and looking up at the pool to see if anyone was swimming because I'm nosy like that. Afterwards, I went to the coffee room to grab my coffee. As usual, it was so good and also so slow as usual again. Very nice in the mornings though. I wish I could stay and study. This is me stressing out because I thought I was gonna be late for work, but we made it on time. Thanks, Mom and Dad. You're so great and amazing, and I love you very, very much. When I got to the clinic, it was basically the same as yesterday. They were still waiting for their assignments, and this isn't normal. It's just because of the pandemic that they have a little bit of a lull in the morning. So we did a lot of modules again, just brushing up on our knowledge on vaccinations and things like that. This is what I wore to the clinic, and for break we went to this cafe called Honolulu Cafe. It's so good, and my friend got a matcha latte iced and it looked amazing, so good job on him. I was super jealous, and unfortunately I brought my own lunch. For the rest of the day, we actually got to shadow the nurses run CHC clinics for children aged 2 to 18 months, where they basically just gave vaccinations, and it was so cool to see nurses work in that kind of setting and have that relationship with parents in the community. Then I just drove home in an Evo. Hey guys, I just got back and there was a Drift magazine package that came in the mail. Patrick's been getting these magazines for the house just because it's nice to have something to put on the coffee table. And I'm really excited to open this one because I'm not sure what location it's based in, but I thought I could open it with you guys and see. The last one I have, you guys might have seen in the home tour, but that one was based in Bali, and they do like a different location every time. And it's just about coffee and how places experience coffee. Wow, it's so nice. So this one's the Los Angeles one. So this is what it looks like outside of the box. It's so beautiful. The photos are so nice. If you guys ever need like a good coffee table magazine, definitely look into Drift magazine. This one's the LA version. I really like it. Look at that. Wow. For dinner, Patrick decided to take me to a ramen place that we really like in Chinatown. It's called Thai Shoken, and they have really good vegetarian ramen. If you guys were looking for a place in Vancouver that makes good vegetarian ramen, I would definitely recommend going there because we really love it and it's not that expensive either. We walked home and it was such a nice night. The moon was out and I really liked the walk. When we got home, we just relaxed, put on a candle, and did some work before bed. So that's 2 days in the life of a public health nurse during my practicum at my specific clinic. Don't forget to like and subscribe if you guys want to see more nursing content. Thank you so much for watching, and I'll see you guys next week.